What genetic mutations are linked to ocular melanoma? Have you ever wondered what genetic factors contribute to ocular melanoma? This type of cancer, specifically uveal melanoma, is the most common primary cancer of the eye. It's important to understand the genetic mutations that can play a role in its development. These mutations can be classified into two main types: acquired mutations and inherited mutations. Acquired mutations, also known as somatic mutations, occur during a person's life and are found in the tumor cells. The most frequently mutated genes in uveal melanoma are GNAQ and GNA11. These mutations are present in about 71 to 93% of tumors. They affect G protein signaling pathways that help regulate cell growth. Interestingly, these mutations typically occur at specific amino acid residues, such as residue 209 in exon 5. While they are early events in tumor formation, they do not predict the prognosis on their own. Another significant gene is BAP1, a tumor suppressor gene. Mutations in BAP1 are found in about half of uveal melanoma cases. When this gene is inactivated, it is strongly linked to a higher risk of metastasis and a worse prognosis. These mutations are usually acquired and only present in the cancer cells. Additionally, mutations in SF3B1 and EF1X are also common in uveal melanoma. These mutations tend to be mutually exclusive with BAP1 mutations. SF3B1 mutations are associated with an intermediate prognosis, while EF1X mutations correlate with a lower risk of metastasis. Other less common mutations include PLCB4 and Sisalter2. On the other hand, inherited mutations, known as germline mutations, can also increase the risk of developing ocular melanoma. One notable example is BAP1 syndrome. Individuals with this syndrome inherit mutations in the BAP1 gene, which predisposes them to uveal melanoma and other cancers, including skin melanoma and kidney cancer. This hereditary form is rare but crucial for assessing family risk. Mutations in the CDKN2A gene, which is also linked to skin melanoma, have been found in some patients with both ocular and skin melanoma, suggesting a genetic predisposition. Additionally, BRCA2 mutations, primarily known for their association with breast and ovarian cancer, have also been implicated in ocular melanoma risk in certain families. Other inherited mutations linked to uveal melanoma include PALB2 and MBD4. Moreover, chromosomal changes play a role in ocular melanoma. Loss of chromosome 3, known as monosomy 3, is strongly associated with BAP1 mutations and indicates a poor prognosis. Gains in chromosome 8 and losses in chromosome 1 also correlate with disease progression. These chromosomal changes can be detected through specialized genetic tests, which can help predict patient outcomes. In summary, ocular melanoma is influenced by a complex interplay of genetic mutations. The most critical acquired mutations occur in the GNAQ, GNA11, and BAP1 genes, with BAP1 mutations linked to worse outcomes. Inherited mutations, particularly in BAP1 and other cancer predisposition genes like CDKN2A and BRCA2, can increase risk in families. Understanding these genetic factors is essential for assessing risk, prognosis, and guiding surveillance strategies for those at risk of ocular melanoma. Always consult healthcare professionals for personalized medical advice and information.